a few clients ask me recently, why do I get back pain when breathing? And so I thought I'd make a video about it just in case you might be having a similar problem. Now in this video, I'm going to tell you a couple causes of back pain when breathing, when it's something to worry about, when it's not something to worry about, and what you can do about it if it's one of those less serious problems. Now, if you find this video helpful, give it a like or thumbs up, and subscribe to our channel so you get notified of our future videos. So first of all, when you have back pain breathing, you want to first rule out anything serious. So things like a heart attack would obviously be the most serious and most urgent to get taken care of. But other things like respiratory infections, pneumonia, pleurisy, you also want to make sure that those are not problems. Now, if you're having a hard time breathing, you're short of breath, and you feel like you can't get oxygen in, that's probably something of more concern that you need to get checked out. But if it's just that you have a little bit of pain when you're breathing and it's very mechanical, it's not there at other times, it doesn't change with exertion like when you're doing more activity, it's only really if you take a deep breath, then that might be more of a musculoskeletal cause. In a lot of cases, it can be a rib that's out of place. It can also be a muscle in your upper back or deep on your rib cage, the intercostal muscles or the rhomboids, or some of the other muscles in your upper back. And if that's the case, there are some really easy things that you can do to help it out. Now, first of all, if it's a rib problem, you can find the rib where it's a problem. And usually if you push along the front of your chest, you'll also feel at about the same level a rib that's either depressed in or a rib that's sticking out a little bit. And if you find a rib that's sticking out, you can just kind of take your fist and push on it, and then take a couple deep breaths, breathing in and putting the pressure on the rib that's sticking out. Now, if the rib is depressed in the front, then it probably means that it's sticking out in the back. And so you would do the same thing, but you'd lean up against a doorway, the corner of a wall, or something that sticks out where you put pressure into the rib and then take those same deep breaths. Now, you have some muscles in your neck that attach to the upper ribs, and those can also cause back pain when breathing. If you're someone who has anxiety, actually an anxiety attack can cause upper back pain when breathing. But if it's less than that, if you're not having a severe anxiety attack, but you're still having some pain, you can have some trouble in your scalene muscles, your upper trapezius muscles, which all attach into your upper ribs, and they're actually accessory breathing muscles. So here's a little tip that you can use to help make your breathing more efficient, more like your body designed it to be, and use less of those accessory breathing muscles from your neck. So if you take one hand and put it on your chest, and take the other hand and put it on your belly. This is something called diaphragmatic breathing. Now, your diaphragm is a muscle, a dome-shaped muscle that lays right underneath your rib cage, and that's normally your primary breathing muscle. So when you breathe, if you take a deep breath in, you should feel your belly rise, and this hand shouldn't move all that much. Now, what a lot of people do, and it's very common, is they take a deep breath and they tense their neck muscles, their chest rises, and sometimes they even suck their belly in, the exact opposite of what should happen. And that puts a lot more stress on these accessory breathing muscles because you're not using your main breathing muscle, the diaphragm, the way that you should. So again, to take a proper deep breath, this is very relaxing. It's actually very good for pain relief as well. You take one hand, put it on your belly, the other hand, put it on your chest. Think about keeping this hand still and just making your belly push out as you take a deep breath in and letting your belly fall passively as you breathe out. Now, you don't really even have to think about making the breath sounds, about breathing in and breathing out. If you just focus on allowing your belly to rise and fall, it's going to change pressure in your abdomen and in your lungs, and that's naturally going to suck air in and push air out without you even having to worry about what you're doing. Don't worry, your body will not forget how to stop breathing, or your body will not forget how to breathe. So those are a couple tips that you can use to take care of upper back pain when breathing. And again, make sure that you do rule out those serious causes first. Now, if you've ruled out the serious causes and you've tried some of these tips and they don't help, there are some manual hands-on techniques that we do here in the office. If you give us a call at the office or visit our website, we'd be happy to help you out on a one-on-one basis. Again, thanks for listening, and if you found this video helpful, give it a like or thumbs up and subscribe to the channel so you get notified of our future videos. Have a great day.